Hello, my name is Marie O'Connor, a student in the Doctorate of Nursing program at Sacred Heart University. The educational content in this online video module was adapted with permission from the Agency for Healthcare Research and Quality's Share Approach training curriculum. For this module, we will be discussing the how-tos of patient decision aids. At the conclusion of this video lecture, you will be able to define what a patient decision aid is and why they are important. We'll be looking at some resources that will help you make your own decision aid. Then I will show you how to make your own decision aid. A demonstration of a provider using a decision aid with their patient will be reenacted. And finally, let's talk about how you will evaluate this process. Patient decision aids are designed for patients with certain conditions to help them think about what's important to them when talking to their clinician about treatment options. It's important to understand when you are developing your organization's decision aids that these are for patients, so using plain language and easy to read materials is a must. Decision aids can provide a structured approach to informing patients about options and prompting them to document and communicate their preferences. The benefits of using decision aids compared to usual care has been shown to improve the patient's experience, decrease the cost spend, and in some instances improve population health. The benefits of using decision aids are improving patients' knowledge of their options. Patients have more accurate expectations of possible risks and benefits. Patients making decisions that are more consistent with their values. Increases patients' participation in decision making. Decreases decisional conflict. And enhances communication between provider and clinicians. First, let's talk about gathering your research, and then we will talk about how to develop a decision aid. There are several different research avenues that you can utilize to make the content you need to make a comprehensive and effective decision aid for your organization. The Agency for Healthcare and Research, or AHRQ, and other organizations have many evidence-based treatment option resources that can facilitate the process of shared decision-making for your patients and help you develop your own decision aid. Why reinvent the wheel? Let's take a look at two of these resources now. As mentioned before, AHRQ has a program called the Effective Healthcare Program. At this site, you will find a growing library of free, easy-to-read treatment option resources for all different types of health conditions. What happens is that researchers gather all the studies on a particular topic and analyzes them. They then develop what's called comparative effectiveness reviews, which are usually hundreds of pages long. They are free for you to view. However, it may be difficult to find the time to read all of them and all their pages. That's why AHRQ then developed documents in plain language for patients, providers, and policymakers based on these larger evidence-based reports. For your purposes, as a provider or working with providers, use the clinician research summaries, which offer the clinical bottom line in a few pages, highlights the strength of evidence behind the report's conclusions, and describes the gaps in current evidence. Once you click on the website, you will be on the Effective Healthcare Program's homepage. On the left-hand side, click on the Research Summaries for Consumers, Clinicians, and Policymakers, highlighted and circled on your screen to the left. This will then bring you to all the research summaries for your viewing. Click on the topic condition you would like to view. This will help you in developing your own patient decision aid and other resource tools used for shared decision-making project you will be implementing in your organization. Next, we're going to talk about actual patient decision aids that are out there being used in practice. The Ottawa Hospital Research Institute has developed a growing inventory of patient decision aids used around the world. This is your one-stop shop for decision aids. You can find this inventory by visiting the site mentioned on your screen. Once you're on this site, you are going to click on the A to Z inventory highlighted and circled on your screen. This is where all the patient decision aids are housed. Once you click on that inventory, you will then click on Browse, or you can search for a particular health condition of choice by typing in the word in the blank box. Then, this will bring you to the list of patient decision aids by categories with the developer of the tool at the end of the link. The great thing about the Ottawa Hospital Research Institute is that their objectives are to conduct systematic investigations to understand decisional needs, design, and evaluate interventions, decision aids, and strategies. Therefore, they have an unbiased view of all decision aids and rates them on a consistent scale using essential elements that must be included based on the literature. So, when you are browsing the inventory, keep in mind that the rating scale results will be available to you as well as the actual patient decision aids. Use the decision aids that you need and change the content to make it pertinent to your organization. The work is already done for you. Take advantage of it. After speaking with your organization's leaders and coworkers, you have decided to concentrate on a certain health condition that you have identified that may benefit from a decision aid. You have done your research on AHRQ's Effective Healthcare Program and Ottawa's Hospital Research Institute and found a patient decision aid you would like to mimic. Now what do I do? Let's take a look at a particular decision aid titled Depression, Should I Take an Antidepressant?, developed by Healthwise from the Ottawa Hospital Research Institute Decision Aid Inventory. The first section should provide the facts, including their current options, key points to remember, and frequently asked questions. The next section should speak about the different options comparing treatment and no treatment. In this section, you can also include some patient testimonies to help the patient relate their situation. It's also important to mention that you should provide information about outcomes of options, both positive and negative, including the chances that they may happen. This is not included in this example. So, you can make another column with statistical information on the side effects a person can experience. Then you have the patients rate their feelings on proceeding with the treatment option or not. After reviewing all the available options, reviewing the benefits, risks, and harms, the patient should then rate themselves on a scale of what treatment choice they are leaning towards. Have the patient quiz themselves to make sure they understand all the information presented in the decision aid. You may want to leave a section at the bottom that would allow the patient to write their questions, concerns, or next steps. Then finally, have a summary page for your patients. Have them write their responses to the questions and have them formulate their ideas and questions. Some patients will not be able to make a decision even after reviewing the decision aid, and that's okay. This still opens up an informed discussion with the provider and patient, which enhances communication. Now, let's go through a demonstration of a provider and patient encounter after the patient has reviewed the patient decision aid titled Depression, Should I Take an Antidepressant? Hello, Joe. It's so great to see you again. During our last appointment, we discussed the possibility of you starting an antidepressant. Have you had time to review the decision aid that I gave you?
Yes, Dr. O'Connor. I went through the entire pamphlet and I just have a few questions.
Sure, Joe. Let's go through the whole decision aid together. The first section talks about the research and facts of taking an antidepressant. This also speaks about some key points such as why some other patients choose not to take them and what's important to remember if you do decide to take an antidepressant. I've also placed some frequently asked questions that I hear from some of my other patients that I thought might be helpful to you when deciding.
This was such a great summary and some of the FAQs were questions I had as well. I don't have any more questions for this part.
Okay, great, Joe. Let's move on to comparing your options. In this section, I broke it down into taking an antidepressant and not taking an antidepressant. Do you have any comments on this?
Actually, yes, I do. Under the section taking antidepressants, it says that I might end up taking antidepressants for a long time. What does a long time mean?
Excellent question. When starting an antidepressant, we will be monitoring you closely, and I also recommend that you receive counseling or therapy in conjunction. During the first 6 months, we might end up adjusting the dose and/or frequency of the medication based on how your body is reacting to it. It may take up to a year to get that dose right. Usually, people will be on antidepressants for years, if not their entire life.
Okay, that's really good to know.
Now, let's talk about your feelings. I see that you wrote down most of your responses toward the decision of taking an antidepressant. Can you explain your feelings to me a little bit more?
Yes, I believe that my symptoms are keeping me from living a normal life and that I am willing to try something else to control them. I'm not worried about the side effects too much and I don't mind that I might be taking antidepressants for a long time.
Okay, sounds like you made a decision. Let's just summarize what you have decided and our next steps. You have decided that you will be starting an antidepressant. I will refer you to a psychologist, and we will follow up with you in 1 month. My office manager will provide you more educational resources for you on counseling sessions and medications. If you have any more questions in the meantime, please don't hesitate to call my office. Do you have any more questions now?
No, not at this time. You have explained everything to me and the decision aid was a great resource. Thank you, Dr. O'Connor, and I will see you in a month.
So, how do I know what I'm doing is working? Are the decision aids that I developed actually making an impact with my patients? The Model for Improvement provides a framework for developing, testing, and implementing change, and it's also a powerful tool for accelerating improvement. This is a two-step process in which you ask yourselves the 3 questions listed in the charts seen here. What are you trying to accomplish? An organization's response to this helps clarify which improvements it should target and their desired results. Actual improvement can only be proven through measurement. An organization should think about how it wants things to be different after implementing a change and agree on what data to be collected for measuring. For example, you could measure HCAHPS scores, send out your own patient surveys, and/or measure patient clinical data when appropriate. A measurable outcome that demonstrates movement towards the desired result is considered an improvement. What changes can we make that will result in improvement? Improvement occurs when a change is implemented, but not all changes will result in improvement. One way to identify which change will result in improvement is to test the change before implementing it. So start small with one condition to a select number of patients. Measure their data and then expand. The second part of this model is the PDSA cycle developed by the Institute of Healthcare Improvement, or IHI for short. This well-known tool within the quality improvement sector starts with the plan section. It's shorthand for testing a change by planning it, trying it, observing the results, and acting on what is learned. This is the scientific method used in action-oriented learning. Some key takeaways from this module are: patient decision aids are useful tools that should be incorporated in a patient-provider encounter whenever appropriate. There are many benefits for patients and provider organization when decision aids are used. 2 resources that should be utilized when developing your own decision aids are AHRQ and the Ottawa Hospital Research Institute. And finally, you should always evaluate your projects. Use the Model for Improvement to gather all the information you need prior to, during, and after the implementation stage. All pictures, videos, and educational materials used in this recording were derived from the Agency for Healthcare Research and Quality's SHARE Approach Train the Trainer curriculum with permission from AHRQ. The original curriculum materials are available at www.ahrq.gov/share decision-making.